So the original idea came by looking at the amount of demand and capacity we had within the department for producing orthotics, and we wanted to introduce a system that would enable a non-clinician to help with the manufacturing process of orthotics, and also a device that would last longer. So we were looking for a device that would last 3 to 5 years rather than perhaps 12 months, and that would also help us to increase our capacity, because we wouldn't have so many people returning for appointments. Before the system that we've currently got now, it was a labour-intensive system that we had. It involved clinicians either sending in plaster of Paris moulds or foam boxes. We'd then have to have clinicians filling those with plaster of Paris to produce a positive model. That would then have to be modified before we could even start to begin to manufacture the orthotic to sit on top of the device, and that could take a number of days, if not a week or longer. The AMPIT system enables us to stand a patient on a scanning device with the foot in a certain position, and the machine will then scan that foot for us. The clinician can input the prescription that they want to onto the device, and the machine will then manufacture the insole within 15 to 20 minutes. So we have a 3D motion analysis laboratory within Ashton Primary Care Centre, and this is primarily used for people with very complex cases where a traditional biomechanical assessment is unable to identify the problem with gait. So we can refer people to motion analysis, and with a set of markers placed on at various anatomical positions, a person can walk across the force plates and in front of the cameras, and it'll produce a 3-dimensional model which the clinicians can then use to identify the problems and arrive at a diagnosis and treatment plan for the patient. One of the benefits that we've noticed is that 99% of patients referred to us now will be seen within 12 weeks. Prior to having this system, that was only 64%. It's also worth mentioning that actually prior to having this system, we had like 604 referrals into the service. And in 2009, we had just under 1,300 people referred in. So not only are we seeing people within the 12 weeks, we're also seeing double the amount that we saw previously.